Yes, you're welcome to my channel. It's your boy Jacob today, and today I'm going to bring you one of those very important topics, because us as content creators, we have to go to the topics which most of us subscribers love, and to some of you they might be obvious, but there are a lot of people out there who don't know this knowledge. So I keep going back on some of the content to just put some things clear, especially to new students who are just coming in these professions. They might not know so much, and it helps with career guidance as well. So today we are going to discuss a profession of a registered nurse versus a profession of a clinical officer. Basically, in most of our countries, these are the common courses, and some people would like to know about these courses, the career path, the amount of money you get after qualifying, what you can do after these courses. So most people like this type of content. So today I'm going to discuss a registered nurse and a clinical officer, basically, which is better, which is a better profession, which can you take, which has a better career path. So we are going to discuss that in detail. So basically, when it comes both of these courses have their advantages, and some have an upper hand over the other in some scenarios. So when it comes to clinical medicine, the qualifications for both clinical and registered nursing. When I'm talking of registered nursing, I'm basically talking the minimum of a registered nurse. In Uganda, what they call the diploma nurse. That's where the registered nurse profession starts from. A diploma, you are called a registered nurse. Below that, you are enrolled. So from the minimum of a registered nurse at the diploma, that's what I'm talking about. The qualifications for a diploma in registered nurses nowadays, to qualify for that course, is 1 principal pass in biology, and also to qualify for clinical medicine, it's 1 principal pass in biology. The years below 2000 below, it just tells you how far clinical medicine has come down. In those 90s, 90 to 95, those years, to qualify for clinical medicine, you needed 2 principal passes and more than that, because there was only one school which was teaching clinical officers, and that was in Bali. And to qualify for the course, you needed really high points, more than 2 principal passes. But nowadays the schools are many and the competition is less. Clinical medicine has been reduced to 1 principal pass. Nowadays you can enter private school and do clinical medicine, which is quite different from what it used to be. And for basically people who opt to go for these diploma courses, are basically people who didn't have a chance to go to the university, or they scored less points, or they didn't have money to pursue the degree courses. And majority of these people come down to these diploma courses like clinical medicine, diploma in registered nursing. Basically they come down to these courses, which is very good because it's a stepping stone and it can lead you to upper heights if you didn't get that chance. Yeah, so basically 1 principal pass is all you need for a registered nursing at the diploma level, and 1 principal pass is what you need for to become a clinical officer. You go and study for 3 years. The schools are quite very many all over the country. The schools are quite very many, but to take up any of these courses, it depends on what you want, because nurses mostly you follow what the providers, the doctors tell you what to do. And for clinical officers, you are trained to be independent. You are trained to do the prescriptions. They have the prescription powers like doctors, so they have that advantage over the registered nurses. So if you want that kind of independence, you can go for clinical medicine, but nurses, registered nurses, are limited in that section. They don't have that much of independence because you are trained to follow what the provider tell you to do. And so If you are looking for independence, that's the advantage clinical medicine can give you. So basically, let's come to the job market. So when it comes to job market, the registered nurses have more jobs than the clinical officers, in that the problem with clinical medicine is the doctors have become so many nowadays, and they have taken over all the positions, all places where clinical officers used to work, because clinical officers were placed mostly on outpatient in most facilities to be the ones to start up on any patients before they are admitted. But nowadays, because the universities giving out medical officers are quite very many, so most hospitals have opted to take up all the positions which clinical officers used to work. So their jobs are limited nowadays. Clinical officers don't have many jobs. For a clinical officer to get a good job, he needs to apply to government. Government hires them and puts them as in charge for health center 3 in public services. But also getting that opportunity is not so simple. But for registered nurses, the jobs are very many. They can work in all good hospitals because they work almost everywhere. Pharmacies, outpatient, ICUs, they work almost everywhere. But for clinical officer, because you are almost doing the same job like a doctor, so you are limited to just clinics and public services. So you have to look in such sections. So if you are looking for a broader way of employment, I think being a registered nurse is better. But if you are looking for career independence, you want to start up your own setting, you want to be independent, you want to have the power over prescription, you can go for clinical medicine. So it depends. Another thing which I can talk about clinical medicine, the advantage which clinical medicine can have over nursing is that if you want to start up a clinic, like most male people, or most people who want to start up their private practice, in Uganda, a clinical officer only needs like 3 years of experience to be given an opportunity, a license to start up a clinic. But a nurse, to be given the license to start up a clinic, you need 10 years. 10 years of experience. So that is a very big difference. So if you want private practice, you want to start up your clinic easier, clinical officers are given less years because they have experience, they are used to prescribing, they are used to taking care of patients, making prescription. Yet nurses are not so much into the world of prescription, so they are given less years of experience to start up clinics. And so if you are looking for private, clinical officers are given quicker licenses to start up clinics. So it depends on what you want. So another thing I can talk about the difference is the international market. So when it comes to international market, most clinical officers are not known worldwide. That's a very big problem. Clinical officers are basically known in East Africa, Uganda, Kenya, Tanzania, Zambia. Yeah, because it's a it's a gap between a nurse and a doctor. So this profession is mostly known here in East Africa. But if you want to move to other countries like in Dubai, or if you want to move to the UK and all there, they don't know clinical officers. So that's where the nurses have advantage in that if they want to work abroad, the profession is known worldwide, so they get more opportunities to work abroad than the clinical officer. A clinical officer, if he wants to work abroad, needs to change profession. So that's the difference. So if you are looking at these factors, if you are looking at which profession to study, you need to compare these factors. You want to start a clinic, you want to work abroad. So if you want to work abroad, if your interest is to work abroad, you need to take up registered nursing. If your interest is to start clinics, have private independence, clinical medicine can give you that much easier and the knowledge. when it comes to upgrading your career, which one is better? All of them have equal opportunities to upgrade their careers. If you are to be a medical officer, I mean a doctor, a clinical officer can move on to become a doctor. A registered nurse can move on to become a doctor. So when it comes to career advancement, it's the same. The only difference is, do you want private independence? Do you want more job opportunities? That's where the difference is. So you have to look at some of those factors if you are to choose these professions wisely. So I've opened it up for you. The choice is yours. But if I'm to say, in my personal opinion, which profession is better, I would go with a registered nurse. But that's my opinion. But it also depends on you. If you feel like you want private practice, independence, you can go and do clinical medicine. That one gives you that. But if you are looking at job opportunities, you are looking at expanding your career in other countries, you can take up registered nursing. So that is my opinion when it comes to comparing a clinical officer and a registered nurse.